don't understand why something can't be covered. So I ended up, here's the prescription for an MRI. We'll look at it a little more sharply than even my clinical acumen can do. That was
Right.
basically me throwing the towel, throw the no
Well,
mas, the no mas, Hector.
I could go back, I suffered what we didn't know was burnout many, many years ago. I had a constellation of symptoms that no one could figure out. And it was all because of the stress I was under. I had a huge office brought about by the fact that I had to see a lot of patients. I had a lot of people working for me. I had a big payroll. I had a big rent roll. I had lots of expenses going on. Using an enormous amount of supplies. It was just eating away at my soul. And I got to the point where I couldn't take it anymore. And I decided I was going to do one of two things. I was going to quit or I was going to do things my way. And I decided at that point that I was going to do things my way. And this is back in the year 2000. What did I decide? To get the other people deciding how I should practice out of my office. I was trained. I knew what I was doing. I knew how I needed to help each patient. I was in the trenches with them. I knew them. I knew their pathology. One on one, I was completely clear about what needed to be done. Yet everybody else on the other side of the middleman stage was saying, no, that's not medically necessary. No, you can't do that. Yes, you can do that, but we're going to give you $4.02. And maybe, it just got to the point where that's enough. I had already been running a hybrid practice where I was seeing functional medicine patients, regenerative medicine patients who didn't have coverage and had to pay me directly. That part of my practice was growing, and that was the part of my practice that I was loving. So I decided to make the transition quickly. I dropped out of insurance. It was a tough year and a half because I first had to learn how to run a business that wasn't dependent upon receiving patients who came from insurance. I had to brand myself, I had to market myself. But believe me, what we don't understand is the thousands and thousands of patients in every town and city that have been failed by the system, that are miserable, that are languishing in pain, that are not getting the help they need because nobody has the time to devote to what's really going on.